What are other elements that predict outcomes in these patients? We know that if you desaturate when you walk below 88%, that is a very bad prognostic sign. This is now data that's over a decade and a half old by Bill Balama at the time at University of Michigan, where they simply took a look at a small cohort of patients and demonstrated that if they desaturated, that was bad. This shouldn't be a surprise. The reflecting effect on that, patients who desaturate often have worse pulmonary hypertension. We know that these patients all develop low-level pulmonary hypertension, and if they have that pulmonary hypertension, again, this data demonstrates poorer outcomes on these Kaplan-Meier survival curves. We know that pulmonary function testing is very important in predicting outcomes. We know that most patients with IPF will exhibit restrictive disease marked by a decrease in their forced vital capacity. We know that the FEV1 to FVC ratio can be normal to increased, representing an increased elastic recoil. We know that the diffusing capacity, representing a loss of the capillary bed, will be reduced, and that the total lung capacity will be reduced. We know that patients with concurrent emphysema may have a counterbalance to that, leading to normalization of the lung volumes and spirometry, but both attacking the DLCO, right? Emphysema makes the lungs big, and pulmonary fibrosis makes the lungs small, and the result is that you may end up at an even number, but both will reduce the capillary events. We know that a low baseline FVC, we know that a declining FVC, that a low DLCO, and a worsening 6-minute walk are all associated with decreased survival. Now, probably the most powerful predictors we have are dynamic ones. In other words, change over time. If the FVC gets worse over time, this is how Collar's data now, being a decade and a half old, that demonstrated that as patients lost FVC, their Kaplan-Meiers clearly demonstrated worse outcomes. Similarly, this is the Lotzi data, again about a decade and a half old. As patients lost function in their DLCO and dropped their value over a 6 to 12-month period, they also demonstrated poorer outcomes. Now, both of these are small patient numbers, 20 and 21 in this particular study. The previous data was also similarly sized. But the reality is this data has been proven numerous times at this point with numerous data sets.